Welcome back. Just 25 minutes before 8 here on the program. The Health Professions Council of South Africa says it's saddened by the increasing number of deaths since the outbreak of COVID-19. It also says it's unfortunate 240 healthcare workers have succumbed to the coronavirus in recent weeks. Experts say while infection numbers are decreasing, it is important to remember that without wearing masks and keeping social distancing and hygiene, anyone could still become infected. In addition, it is important to understand what is meant by comorbidities and why, if one has other underlying illnesses, it makes recovering from coronavirus more difficult. To get an update on the latest with regard to coronavirus, we are joined by Dr. Kgosi Letlape. He's the president of the Health Professions Council of South Africa, and Dr. Daksha Jivan, a physician and endocrinologist at Charlotte Maxeke Johannesburg Academic Hospital. Good to have both of you. Thanks so much for joining us.
Thank you. Good to be with you.
All right. So, Dr. Letlape, let me begin with you. We quote 240 figures, that's of the amount of healthcare workers that have died from COVID-related illnesses. That was on the 21st of August. Do we have any updated figures, or is that the number that you still have available to you as well?
Well, we are aware that there have been more deaths among healthcare workers. I don't have the updated figures, but that figure has gone up.
Yeah. All right, so 240 is not as accurate because there may be more, but we'll have to look deeper into this. But if we look to reasons to this, the HPCSA does cite that not having adequate PPE has resulted in frontline workers becoming infected. Is this the main cause? Perhaps you can talk to us about how dire the situation is.
I think that there'll be multiple factors. The presence of PPE would be one factor. But the other major factor is the working conditions, the number of staff that you have, the human resources that you have, the working hours, insufficient breaks, and sometimes the spatial arrangements. And part of it has to be greater vigilance from the healthcare professionals themselves. That when you go into areas where your guard might be off, like the tea rooms, the open corridors, the other areas of the hospital where the use of PPE, complete PPE, is not heightened, people still need to be careful. We also need to be careful when we get home, when we use public transport and all other means. So as a healthcare worker, not only do you have to be alert in the work situation, you also have to be vigilant in the social circumstances and even when you're at home.
Yeah. And, you know, we've spoken to the unions, and they've spoken to us about the conditions that some of the healthcare workers are currently under. They go from treating patients to cleaning the wards, to cleaning the floors, to emptying dustbins, to, you know, at some times even buying their own PPE because they don't have available. I mean, this should not be the situation. And I mean, I'm not sure what we need to do to sort this out.
I think what is extremely disheartening is the fact that the resources are there. Even on human resources, we have a lot of human resources that are lying idle. We could have utilized the private GPs more. We could have given them more protective equipment. There's also the issue that people concentrate only on the public side. We're losing quite a lot of general practitioners in their own settings. And part of the problem is that they've gone through difficult times where the number of patients went down, payments from medicals were low, and they now have to invest in providing a COVID-19 compliant environment. If you look at other jurisdictions, funders have increased payments by 10 to 15% during the COVID period, understanding fully that the people, the healthcare practitioners, have to increase the expenditure in terms of making their practices COVID compliant. None of that has happened in this country. And it's quite disheartening when you see the amounts of money that are being dished out on tenders when the frontline is not as safe as it could be.
Yeah, it certainly is a great concern that I think we have given a lot of attention to, and yet it's still not working. I want to bring you into the conversation. Dr. Jivan, you're based at the Charlotte Maxeke Johannesburg Academic Hospital. I know that we've given a little bit of background into the conditions that a lot of our healthcare professionals are working under in South Africa. Perhaps you want to add your voice to this. What is it like for you going into work every single day, seeing the nurses and the doctors and, you know, the cases that are coming in? What is it like on the front line?
So, Leanne, it has been a difficult couple of months. And what I want to add to what's been said is perhaps a little bit of a realization of humanity. And what's happened is a lot of our healthcare workers, doctors and nurses, have been falling sick over the last couple of weeks. And what tends to happen, because we have a certain number of staff, is that then colleagues need to step in. And what's happened over the few months is that there are some people that haven't managed to take any leave, that haven't managed to get any weekends off. So it has been, from a staffing perspective, quite difficult. Not to talk about the mental anguish. I mean, we've seen lots and lots of people becoming very ill from coronavirus. Coupled with that, there's concern about us getting infections, taking the infection home to our families as well. Yeah. That has been a difficult time.
Yeah, I can imagine. And, you know, I don't know if we as South Africans are thanking the medical profession enough for all that you are doing and going to work tirelessly, sometimes working 2-3 shifts in a row, not sleeping, not seeing your families. And, you know, we need to thank you more. And the conditions are not helping either, with not getting assistance in each direction. But I want to sort of get as much info out of the interview as we possibly can. And again, Dr. Jivan, I'm going to stay with you because there's so much misinformation doing the rounds with regard to comorbidities, the wearing of masks, sanitizing. I mean, we just had an interview in the previous hour where our guest was saying that they're heading to the court to say that we shouldn't wear masks, that is against every sort of right that we as South Africans have to choose whether we want to wear a mask or not. I want to start there because it's important to balance the information that we are sending out as a public broadcaster. What is the standpoint on masks? Governments say it's mandatory. That's the one thing that can help stop the spread. As a medical professional, should we wear masks? Is it the right thing to do? Does it stop transmission or mass transmission?
All right, so from the medical community, from the scientific community, I have seen a number of studies that actually show that mask wearing has been beneficial. So important from two ends. So if someone is ill, for example, at our hospital, any patient that comes in with coronavirus that is coughing and sneezing and is passing droplets into the air is given a mask so that they can stop spread to other patients. It's as important as well for people that are healthy to wear masks, just in case you're coming closer to them than the 2 or 3 meters that's required for you to socially distance. I think masks are extremely important in curbing that droplet spread and that aerosol spread.
All right. Dr. Letlape, we're seeing a lot of children going back to school now. Schools are basically opening up in full force. And, you know, we asked the question yesterday to our viewers if they felt a lot more comfortable sending their children back to school. And I must say, many replying, yes, they do feel more comfortable. However, there are some schools that are still not ready from what our research showed yesterday. Let's talk about the risk of children passing on the virus. We've looked at it quite a bit, but let's visit that again. And we understand that children are not really affected as much as an adult would be by the coronavirus. Talk to us about that, and also the use of masks in children. It's been said by the World Health Organization that over the age of 12, it should be mandatory to wear a mask, but below that age, let's talk about that.
I think it depends on the circumstances. If you're going to get into a crowded situation as a child, you also need to be protected. Remember, the fact that children don't get as sick as adults does not mean they do not transmit. And the problem is that we have lots of children that live in households where they are being raised by grandmothers. So they live with vulnerable populations. So we have to step up our efforts to ensure that we don't use children as vectors of the disease, even though they might not themselves be severely affected. But we also have to take into account, Leanne, the unevenness of the country, that not every school is at the same level. There are no minimum standards that are being kept. There are schools that are not ready to take any children. There are classes that are overcrowded. I saw a news clip yesterday of a school in Mpumalanga that has 6 classes and over 600 students. Now, when all those people come back, they'll be overcrowding. The fact that we have precautions, we can't now use our children as cannon fodder and not take care of all that we know we should be doing, including using of masks. Where it has not been advisable to use masks is children under 2 years of age. But children older than that, children from 4 years on, it's safe for them to use masks where it is appropriate for them to use masks. Yeah. And going back to the previous topic about people that don't want to use masks, we must also remember there's asymptomatic carriers amongst adults, where you have people that don't have any signs of the disease, but they are COVID positive and they can still transmit if they're still within the infective period and can spread the disease. So the use of masks should be a social responsibility that needs to be, compulsory. You should not be able to get into a public setting and not wear a mask.
Indeed.
What you do in your own home, that's where the individuality could stand. Yeah. And I think we have a crossroads in terms of the over-democratization of our rights. We do not counteract with our responsibilities to others and our responsibilities to society. So you may have a right not to wear a mask, but I also have a right not to be contaminated by whatever you may or may not be carrying. Indeed. How do we balance those rights?
Yeah. Interesting, very interesting perspective there, Dr. Letlape. Thank you. But let me move on to you. I'm getting confused with all my doctors that I'm talking to this morning. I'm in a great position, Dr. Jivan. I want to talk comorbidities because that was the big thing when it came to coronavirus. Now, we're a good 5 months into it, and I imagine a lot more has been seen. We haven't, as official statistics that have been released of those that have unfortunately succumbed to the virus, or some aspect of the virus has been responsible for their death. We talk to comorbidities. What are the biggest ones? I mean, we've been told diabetes, hypertension, in some cases obesity, high blood pressure, cardiovascular, people that have cancer. Has anything stood out that affects more than others in terms of comorbidities?
So thank you, Leanne. The ones you've mentioned are all correct. Diabetes, hypertension stands out. What I do want to add is heart disease. So ischemic heart disease is an important comorbidity. And what's in common with the comorbidities is they are all generally metabolic diseases. Now, metabolic diseases are important because they alter the way our immune systems work. And that is important in counteracting infections and viral infections like this one. So what we've seen is these comorbidities actually change the way our immunity works for coronavirus. And that is part of the reason why these comorbidities cause more severe disease.
I want to also talk to the after effects of this, because I've been seeing of late, because a lot of people obviously have had it, they're trying to recover, but there's just those things that they keep complaining about, and a lot of them speaking to, I think they've been dubbed the long haulers, if I'm not mistaken, please correct me, but this terrible feeling of exhaustion, some struggling to breathe, a lot of people suffering from what they call brain fog, that they just can't think straight, and other issues of still not getting their taste and smell back. The long-term effects of coronavirus and being affected, what are we seeing there?
All right, all of those that you mentioned are correct, Leanne. I just want to draw attention again back to metabolic. All right, so with diabetes in particular, what can happen through coronavirus is it causes worsening of glucose levels, and it can precipitate new diabetes as well. So more severely, rather than what we're seeing in terms of symptoms, the fatigue, the shortness of breath, it is important. Again, I'm going to bring up the word metabolism, because this virus has been shown to alter metabolism longer term as well.
Amazing. What about fertility? There's been questions raised about whether or not it affects fertility.
So, Leanne, I'm not, unfortunately, a gynecologist or obstetrician. I am not familiar with any effect on fertility in my line of work.
Okay, good. Dr. Jivan, thank you. I mean, we obviously ask in all questions we can, and especially questions that are coming through on social media, but it's a question that still remains, and perhaps we can pass that on to somebody else. I want to just wrap up the conversation very quickly, and Dr. Letlape, let me come to you. This second wave that we talked to, I mean, the numbers coming in are exceptional. When we were getting 14, 15,000 cases per day in South Africa, we saw just over 1,000 infections yesterday that were reported. So we're in a phase of a downward trend, but there's that second wave that we speak to. Any ideas about this second wave and whether or not, you know, South Africa, I suppose, are going to go through what we had already been through?
I think part of what we should not forget, and as the minister keeps repeating, is that we've got to do the basics. The physical distancing, the washing of hands, it's critical. You were talking about schools. Access to water is still a challenge in many schools. So we should not let our guard off. And as an individual, you must take personal responsibility. Still avoid crowds. Be cautious about going back to crowded places like gyms, depending on how they conduct themselves and whether they can conform to the regulations in relation to opening of gyms, funerals, churches, taverns, any restaurants that do not comply with COVID distancing, where occupancy is not appropriate for prevention of spread. And the problem is that all nations that have gone through huge surges are now seeing second waves. Spain, South Korea.
Yeah.
Let's remember that New Zealand celebrated having no infections over 15 days. They've now gone back to lockdown. So even in the most compliant of societies, we see the second surges coming back. So we need to continue to be vigilant. Even though we're now in lockdown level 2, personally, we should just on our own behave like we're in level 4 or level 5.
Yeah.
Don't do unnecessary trips.
No,
be cautious about family gatherings.
Yeah.
Wear masks wherever possible. Even when families meet, you don't know where your cousin has been. You don't know where your brother has been. Protect yourselves from each other.
You are so right, Dr. Letlape. Just act that way. I've got to wrap. I'm being shouted at. But Dr. Letlape, I have to ask you this question. There are threats of a strike in the medical industry, in the medical sector, by healthcare workers. Obviously, there's the issue of the fact that they have an obligation, an ethical obligation, to heal people and to go to work, but they also need to hear their grievances heard. If you can, very quickly, what is your standpoint with regard to healthcare workers downing tools completely across the country?
Our stance is we put our patients first. A stance like that would be taking away from our ethical obligations and the oath that we take. So we need to negotiate with the employer for a safe working environment. But under no circumstances do we promote, condone, or support patient abandonment. That would be a violation of our basic ethical rules. I am for improved working conditions. I am for a safe working environment, but not at the expense of the patient. We've seen doctors double up when other workers have not been there, cleaning, nurses staying on, cleaning and doing other people's work. My plea, let's all be healthcare workers. Let's put society and patients first while we're still negotiating with the employers to improve their working conditions. There is no room in our ethical rules for abandoning our patients.
You have been Fantastic. Both my guests here this morning giving us great information that I think we need to adhere to just to be safe and respect those around us. And again, we thank you for the work that you are doing on the front line there, especially to our Dr. Daksha. Jivan is a physician and endocrinologist at the Charlotte Maxeke Johannesburg Academic Hospital, talking to us about what's happening there and also just giving us some advice with regard to looking after ourselves, some of the comorbidities. Dr. Kgosi Letlape, who of course is the president of the Health Professions Council of South Africa as well, for your valuable insights. Quick break. We have to start saying goodbye to our SABC 2 viewers after this. Stay tuned.